there's a series of clips here. I want to play Boris Johnson, the Prime Minister, who assured us that care homes had been locked down before the rest of us had been locked down, when in fact a Reuters investigation has now established that was a brazen lie and that in fact care homes were the last places to be locked down. Let's watch this.
We brought the lockdown in care homes ahead of the general lockdown.
So right from the start, we've tried to throw a protective ring around our care homes. We set out our first advice in February, and as the virus grew, we strengthened it throughout. We've made sure that care homes have the resources they need to control the spread of infection.
People are only released from hospital if the clinical judgment is that it is better for them to be in a different setting. And the number of people who've been discharged from hospitals into care homes has been declining throughout this pandemic, and it's also 40% less than it was this time last year.
Now, the reality is, as the Reuters investigation has established, is that all of that was a lie. Pretty much everything you've just heard was a lie. And in particular, it was a lie that there were clinical reasons given for people being released back to care homes. There weren't. In fact, there was a direct order from the top of our public health officials to clear bed space in the NHS and to send thousands of people out of hospital to care homes. And we now know, because we've seen enough stories now coming out, that people were sent back with COVID-19 and they then spread the virus amongst other residents in the care homes and people died. And your mother was one of those people. So, Sarah, for you, when you hear government ministers and the Prime Minister basically saying, hey, we did everything we could have done, what's your reaction?
We're just so angry. We feel completely let down by the system. There was never any shielding in place for those care homes. They were the bottom of the pile from the beginning of this crisis. Nobody ever put any plans in place for the care homes. And we feel not only desperately sad for the loss of our mother, but we feel so angry that this wasn't her time. You know, she should not have died. If the right shielding was in place, our mother would not have died from this virus.
Well, March the 13th, Public Health England issued guidance which said that visitors who are feeling unwell shouldn't visit care homes. So if you had symptoms, you should stay away, which makes perfect sense. But there was no ban imposed on visits. On the 23rd of March, the government issued a general lockdown. But it wasn't until April the 2nd that they issued a new advisory, according to the Reuters report, by the Department for Health and Social Care, saying visits should only be made in exceptional circumstances, such as when residents are dying. So when the Prime Minister says there was a lockdown before the rest of us, actually the truth is it came at least a week afterwards. And as a result, 22,000 people have died, more than the average in care homes.
And Ruth, the issue, of course, with your mum and the care home where she lived was that they received into the care home somebody who had this highly infectious disease. I mean, you must be beside yourself about that. If that person had been kept in hospital, things would have been different.
You're sending a deadly virus into a place where vulnerable people live together, and it's like the perfect storm of, you know, words fail me that the instructions were to the hospital that the lady who lived alongside mum, who was diagnosed with COVID-19, was sent back to the home. I mean, and the fact that all through this, it's almost like whoever does the modelling and whoever comes up with the great plans that mean you can build a Nightingale clinic in 9 days hadn't thought about care homes. Nobody had thought about the most vulnerable people in society who live locked up together.
You live in a home together, so you're essentially putting that virus into that entire home.
And from a testing point of view as well, because the people who work in the care home weren't being tested, many of them were going off sick with symptoms, but that meant that you then had staff coming in from agencies who were then going to multiple care homes.